Did you know that an ordinary walk led to one of the most beneficial treatments for trauma and mental health issues? Eye movement desensitization and reprocessing therapy, or EMDR, was discovered by psychologist Francine Shapiro in the late 80s while taking a stroll in the park. Struggling with her own distressing memories, Shapiro discovered that as she walked, certain eye movements seemed to help calm her intrusive thoughts and decrease negative emotions. In fact, these eye movements were helpful to desensitize her to these memories, in other words, making them less powerful. After several years of research and refining the technique, we now know EMDR as a set of standardized protocols that incorporate elements from many different treatment approaches. This highly respected intervention has been proven effective for the treatment of trauma, as well as a variety of other mental health issues. Some of the issues that EMDR can treat include trauma and PTSD, anxiety disorders, depressive disorders, disturbing memories, eating disorders, body dysmorphic disorder, obsessive-compulsive disorder, and personality disorders such as borderline personality. So how does EMDR work? Well, it appears that EMDR has a direct effect on the way the brain processes information. This is really beneficial to someone who has experienced trauma, and as a result, their brain cannot process information as it normally would. You see, to these people, a moment in time becomes stuck in their minds, and they experience that trauma, the sights, sounds, smells, and images over and over again. This, in turn, affects how they see the world around them and how they relate to other people. After successful EMDR treatment, the brain can once again process information quote-unquote normally, and the person no longer relives that trauma. While they still remember that the event happened, they are not physically, mentally, or emotionally upset by it. In other words, they become desensitized, just as Shapiro discovered decades ago on her walk. What is perhaps most interesting about EMDR is that it appears to be very similar to what occurs naturally during REM sleep, also known as rapid eye movement sleep. For this reason, EMDR can be considered a physiologically based therapy that helps individuals deal with distressing events, but in a new and less disturbing way. So what are EMDR sessions like? EMDR is an integrative psychotherapy approach that incorporates 8 phases of treatment. How long it takes an individual to experience benefits of this therapy, of course, depends on their personal history. But treatment typically targets 3 different areas: past memories, present disturbance, and future actions. The goal of EMDR is to process information and experiences differently. Each session aims to leave the client with healthy emotions, understanding, and fresh perspectives that will ultimately lead to healing. So how long does EMDR take to work? So it's often helpful to have 1 or 2 sessions to really allow your therapist to fully understand the nature of your problem and to determine if EMDR therapy will be an appropriate treatment. During these sessions, the therapist will answer any questions you may have about the process. And then once you and your therapist agree that EMDR is the right way to go, actual therapy can then begin. How many sessions will be required is going to be based on the type of problem, personal circumstances, and the severity of the trauma. Now, EMDR may be used within a standard talking therapy session, as an adjunctive therapy with a separate therapist, or as a standalone treatment.